Hello, my name is Lauren Sanders, and today I will be discussing with you my research paper on Helicobacter pylori, pathogenesis, and treatment progress. Helicobacter pylori is a gram-negative microaerophilic bacterium that colonizes the stomachs of its hosts. H. pylori is a slightly helical, highly motile bacterium that is helix-shaped. It is about 3 micrometers long with a diameter of about 0.5 micrometers. It is classified in the class Delta Proteobacteria. H. pylori usually appears spiral-shaped. However, the bacterium can sometimes appear as a rod. Coicoid shapes occur after prolonged in vitro culture or antibiotic treatment. H. pylori is microaerophilic, that is, it requires oxygen, but at a lower concentration than in the atmosphere. It produces oxidase, catalase, and urase. It has flagella and is urase positive, a characteristic that is essential for colonizing the stomach. The organism has 2 to 6 unipolar sheathed flagella of approximately 3 micrometers in length, which often carry a distinctive bulb at the end. The flagella make it mobile and allows quick movement in viscous solutions such as the mucus layer overlying the gastric epithelial cells. And here you can see the flagella hanging off of the Helicobacter pylori, and this is what makes it motile. What does H. pylori cause? Helicobacter pylori causes gastritis and most peptic ulcers, which are erosions of the mucous membrane of the stomach or of the initial portion of the small intestine. It has also been associated with duodenal ulcers, gastric ulcers, and the epidemic form of gastric carcinoma. How does somebody get H. pylori? H. pylori is contagious. The entry site for H. pylori is through the mouth. Studies have shown that humans are infected with H. pylori when they come in contact with feces on the hands, in well water, and on fomitus. Also, cat feces may be a source of infection. Person-to-person transmission by either the oral-to-oral or fecal-to-oral route, including saliva, feces, vomit, and other body fluids are most likely. How is H. pylori transmitted? H. pylori may be transmitted orally through drinking waste-tainted water. It is more common in countries or communities that lack clean water or good sewage systems. H. pylori, how does it attack? It attacks the stomach by causing the formation of peptic ulcers. The process begins when H. pylori invades the stomach's protective layer of mucus and attaches to the gastric epithelial cells. The bacteria attach to the cell's cytoplasmic membrane and multiply. And here you can see an illustration of Helicobacter pylori coming in to the stomach, invading the protective layer of the mucus and attaching to the gastric epithelial cells. And then as it goes in, it's going to multiply. What does H. pylori cause? This causes several factors, including triggering inflammation by bacterial exotoxin and the destruction of mucus-producing cells by the bacteria. Helicobacter, its toxins and inflammation cause the layer of mucus to become thin, allowing acidic gastric juice to digest the stomach lining. Once this has occurred, H. pylori has gained access to the underlying muscle, tissue, and blood vessels. Gastric acid destroys epithelial cells and underlying tissue, and a peptic ulcer has been formed. These ulcers may bleed, cause infection, or keep food from moving through the digestive tract. And here you can see an illustration of a peptic ulcer, the damage that Helicobacter pylori does to the mucus layer, the bacteria colonizing the stomach's mucosa, and acid as it passes through the weakened mucus layer and causing an ulcer. Body reaction to H. pylori. Here are some of the symptoms. A person infected with H. pylori may never experience symptoms or complications. Acute infection may appear as an acute gastritis with a stomachache or nausea. According to the Centers for Disease Control and Prevention, the most common ulcer symptom is a gnawing or burning pain in the epigastrium. Some other signs of an ulcer include burping, heartburn, bloating, nausea, not feeling hungry, vomiting, weight loss for no clear reason. Bleeding can also occur. Prolonged bleeding may cause anemia and lead to weakness and fatigue. Who is at risk for developing H. pylori? The prevalence of H. pylori varies greatly throughout the world. Approximately 2/3 of the world population is infected with H. pylori. It is more prevalent in various developing countries, even from a young age. The developing world has much higher rates of infection than the industrialized countries, including the US and Europe, where the prevalence of H. pylori generally remains under 40%. And here you can see a map showing the prevalence of H. pylori around the world. You can see in the United States and Western Europe, it is less common, about 30 to 40%, whereas in South America and Africa, it's very common, 90 to 80% of the population has it. The prevalence of H. pylori is directly correlated to one's socioeconomic status, in particular in relations to their living conditions, clean water, and good sewage system. While the prevalence of H. pylori infection in developing countries remains relatively constant, it is rapidly declining in the industrialized world due to improved hygiene and sanitation. H. pylori in the United States, the prevalence appears higher in African American and Hispanic populations, and older adults, most likely due to socioeconomic factors. The lower rate of infection in the West is largely attributed to higher hygiene standards and widespread use of antibiotics. It is hypothesized that H. pylori infection is largely determined by environmental rather than genetic factors. Prevention of infection of H. pylori involves the following: good personal hygiene, adequate sewage treatment, water purification, and proper food handling. In general, it's always wise for persons to wash their hands thoroughly, to eat food that has been properly prepared, and to drink water from a safe, clean source. Thank you for your attention.